Long COVID refers to persisting symptoms. So typically after COVID-19 infection or any viral infection, usually patients have symptoms for a couple of weeks and they get better. But long COVID refers to persisting symptoms that go on for weeks, months, and now we know years after the initial COVID-19 infection. It means the patient has not returned to their previous level of health or their previous baseline. They've got ongoing symptoms that are some way affecting their day-to-day life. Long COVID obviously has many symptoms, and it causes a lot of problems for patients. But as far as the respiratory system is concerned, probably the biggest one is breathlessness. So patients can't do what they used to do without getting out of breath. That could be simply climbing stairs or going out for a run or doing their normal housework or just their normal day-to-day activities. That's the main long COVID respiratory symptom. That's also linked to other symptoms such as a feeling of a heavy weight on the chest or chest tightness. Patients also reporting wheeze, coughing. It's another sort of persistent dry cough. Some patients just have general fatigue, therefore they just feel too weak to do their normal activities, which can be sort of confused with actually being out of breath or out of puff, as it were. Those are sort of the main things. Some people get chest pain. It's not clear whether that's coming from the lungs or the lung lining or the lining around the heart. So chest discomfort, chest pain is also quite a common respiratory type symptom under the long COVID umbrella. We don't know exactly, because obviously we've only known about COVID-19 infection since the early part of 2020. But what we do know is that the lungs can make a full recovery, and that can be looked at by x-rays and CT scans and lung function tests. Or the lungs can have semi-permanent damage at the other end of the spectrum, where the lungs are scarred, and we know those lungs, once they're scarred, they will not recover. And in between those two ends of the spectrum, there are a number of different scenarios. So some people have quite significant damage to their lungs. The actual air sacs or air spaces are damaged, but over a number of weeks that recovers, and we see clearing of those abnormalities on an x-ray or on a CT scan. In other cases, the tubes of the lungs, what we call the bronchial tubes or the airways, get narrowed, they get irritated or inflamed. And again, that can heal over a number of weeks or months. In other cases, it seems to be more of a prolonged problem, especially if the patient has pre-existing conditions such as asthma. So there's lots of research going on about the long-term effects on the lung and whether certain drugs that we use for other conditions, for example, there's a drug we use for pulmonary fibrosis called pirfenidone and a similar one called nintedanib, whether those will help the scarring process in patients that have what we call fibrotic lung disease after COVID. And there's trials going on. We don't know whether it's definitely going to work, but there are definitely trials going on to see whether those sorts of medications can help people. Absolutely. I've seen hundreds of patients over the last 18 months with long COVID symptoms, and the vast majority do improve with targeted treatment. So the key is to make a clear diagnosis. Long COVID is an umbrella term for many conditions that all result from having had COVID-19 infection. And in some patients, it is down to an asthma-like syndrome. So they either had asthma when they were children, or they've got a family history of asthma, or they suffer with related conditions such as hay fever. And it seems that after COVID, the COVID process seems to stimulate the immune system to cause problems in the tubes, the bronchial tubes going into the lungs. And that means those tubes are irritated, they're easily inflamed, they're very reactive. They may mean there's mucus being made in those tubes. And the sum total is that there is impaired air going in and out of the lungs. The chest can feel very tight, patients get wheeze. So we know that asthma therapy that's targeted at those tubes helps some of those patients to open up their lungs, reduce their breathlessness, and reduce their symptoms. So we can detect this by doing very specific lung function tests, where patients come to the lung function laboratory and we put them through various tests to see whether they are behaving in an asthma type way, and if so, what types of treatment would work. So it's all about targeted treatment based on objective evidence of a clinical problem, in this case, an asthma type syndrome. Even though the virus has been cleared, the body still feels the virus is there and mounts a big response from the immune system. And that causes like a pneumonia pattern in the lung called an organized pneumonia. And we can see that in other conditions as well, but we definitely see it post-COVID. And that can cause long COVID symptoms because the actual air spaces in the lungs are filled with fluid or more solid material rather than being full of air. And we know those patients respond very well to steroid therapy given over a number of weeks. And we see over that time period, the x-rays, the CT scans improving, and the patients having a much better level of functioning. So long COVID respiratory symptoms can be treated, but it's key that a patient is seen by someone who has expertise in this area, who's seen lots of patients and has lots of experience and can do the tests that are required to make a definitive diagnosis to say what actually is happening in the lungs, at what level of the lungs the problem lies, and then have targeted therapy for those particular problems. So there is a science to this. There is a very structured way of approaching long COVID and respiratory problems. And it's really important patients don't just feel they have to live with these symptoms. They don't feel they're going to be like this forever, or nature will take its course and eventually they'll get better. It's really important they get help and see a specialist and get a great understanding of what's happening in their lungs and get the right treatment. Managing symptoms after COVID, whether it's long COVID or shortly after the illness, very much depends on what symptoms are troubling you. For example, if you've got really severe post-COVID symptoms, to the point where you struggle to walk from one room to another in your house, then what you can do with that is going to be very much more limited. That's going to be a very gradual increase in your day-to-day levels of activity. On the other hand, if you're someone that normally runs marathons or does triathlons, and the main problem is that you can't get the speeds or the pace that you used to do previously, then obviously that is going to be a completely different problem and will require a sort of a gradual approach to build up your stamina again, your exercise tolerance. But it really boils down to what is limiting the patient. Are the lungs damaged or scarred? Are the tubes carrying the air and oxygen into the lungs actually narrowed or constricted or causing problems? Are the breathing muscles actually weak? Is that the problem? Or has a patient lost their normal breathing rhythm or breathing cycle? Is that why they're struggling to do day-to-day activities? So it really goes back to getting a clear diagnosis, pinpointing where the actual problem lies within the respiratory system, and then having targeted treatments to manage those. But the key is not to overdo things, not to push things too hard, because that may actually put your recovery back by causing excess fatigue. It could also put a strain on the heart that may be recovering as well, because the lungs and heart are very interlinked. So if you push your lungs too hard, that could cause problems with your heart rate going too fast, and that may affect your long-term recovery. So it's about having a very structured exercise program of recovery, taking the medications that your specialist has recommended to support that recovery, and knowing that unfortunately it is a bit of a long-term recovery program. People get very disappointed and can get quite depressed because their progress or their recovery is slow. But unfortunately, that's the nature of long COVID. It's often small steps on the road to recovery, rather than being, by next week I'll be back to normal. So it's about being patient. It's about getting the right advice. It's about having the right support, and it's about having a structured program of recovery that can be sustained and doesn't cause any harm. There are many ways that patients can get supported, and it depends really where you are. Obviously, in the United Kingdom, we have the National Health Service, so there are long COVID clinics. There are community-based recovery programs. There are very targeted rehab programs which can be accessed either directly by the patient or they can be referred by their doctor. And over the last 18 months, we've got lots of expertise in helping people recover. In other countries where they may not have a national health system or national health service or access, there's lots of online resources through reputable sites, and certainly the American Thoracic Society, the British Thoracic Society, the European Respiratory Society have lots of resources on their websites. And there are many physiotherapists, for example, doing YouTube channel showing people how to manage their breathing, how to work with disordered breathing, as I mentioned before. So there's lots of different resources, but the key really is to have a clear diagnosis, so you know that when you do start your recovery program, you're not going to cause yourself any harm, particularly making your heart struggle or your heart rate to go too fast. It's really important. And then it's utilising resources available from your local health system, or doing your own research and going online and looking at reputable websites that will have information. But the key really is to get a clear diagnosis of what type of long COVID you have, what specifically has been affected by the long COVID or the post-COVID effects on your lungs, and to have the right approach so that you get it right first time. You get the right approach from the very get-go, and that'll give you the best chance of getting back to your normal activities, getting back to work, getting back to your normal life again.